Ministre de la Santé et des Services sociaux, Mme Danielle Mécan, et le directeur national de la santé publique, Dr Horacio Arruda. Monsieur le Premier ministre, à vous la parole.
Merci beaucoup. Donc, bonjour tout le monde. Le bilan pour la journée d'hier, 139 cas de personnes infectées, donc 18 de plus que la journée précédente. 10 personnes hospitalisées, donc 3 personnes de plus que la journée précédente. Toujours un seul décès, donc pas d'augmentation. On a actuellement 2400 personnes qui attendent un résultat de test. Ça devrait arriver rapidement. On a jusqu'à présent 7700 résultats négatifs qui ont été obtenus et le nombre de tests augmente de façon très importante. Actuellement, on a une capacité plus grande que ce qui est demandé à notre réseau. Aujourd'hui, ce que je veux vous dire aussi, c'est qu'on ajoute des numéros de téléphone. Donc, le numéro général reste le 1-877-644-4545. Mais maintenant, ça va être possible en composant le code régional de votre région. Par exemple, à Québec, 418-644-4545. À Montréal, 514-644-4545, etc., là, pour les autres régions. Je veux vous dire que pour l'instant, quand on regarde le réseau de la santé, la situation est toujours sous contrôle. On a libéré 4000 lits qui sont disponibles, donc en reportant des chirurgies électives. Je veux vous dire aussi qu'on a assez d'équipements à court terme, mais on travaille quand même sur des scénarios plus pessimistes pour être prêt au cas où. On parle déjà, on a commencé à parler avec des entreprises, si c'est nécessaire, pour construire des respirateurs, pour fabriquer des masques, pour fabriquer tous les équipements qui pourraient être essentiels s'il y avait une situation qui devenait beaucoup plus critique. La direction de la santé publique m'assure que toutes les mesures qu'on met en place, ça donne des résultats, ça aide.
Setting up have given results and are giving results and are helping in delay and postponing the contagion of a lot of people. I'm very happy to see that more and more people are now aware of what the guidelines are. Still, as of 6 p.m. tonight, we've asked Dominique Michel and Bernard Durham to record messages that are going to be transmitted over the phone to people 70 years and over in order to repeat what those guidelines are. It's also a way of being able to reassure the population as much as possible. Of course, the most important guideline is, if you are ill, if you have any symptoms, please stay at home. Isolate yourself and make sure that you see no one else. We really have to make sure that we keep doing this because we have some difficult weeks coming up. People have to continue following the guidelines. Today, I want to tell you about construction sites. Right now, you've seen it in the economy. There's a lot of jobs that are being lost. The private sector in particular is facing great difficulties and has been forced to lay off some employees. We are trying, as we mentioned yesterday, to set up measures in order to help as many businesses as possible. The government, however, will be announcing in the next few days infrastructure projects that are going to be done ahead of time. I don't need to tell you that in education, in roads, public transportation, health, there are a lot of infrastructure projects which had to be done anyway. So what we want to do is do them earlier to be able to replace the construction projects that have been canceled in the private sector by these projects that are in the public sector. And it is important to say it. 270,000 jobs in Quebec are in the construction sector. And if there's an economic sector that can continue working and functioning despite the crisis, because we will be asking people to be able to realize these projects, and that means 270,000 people. Well, in order to do so, we have to make sure that all conditions and all precautions are being taken by a business. So today, what I wish to do is to address myself to all employers, all construction company owners. It is very important, if we wish to protect this economic basis in the construction sector, to be able to offer employees all the precautions that are necessary. What this means concretely is that workers in the construction sector have to have access to a place with water and soap so that they can wash their hands regularly. And I'm thinking about construction sites, for example, that are outside. So there have to be more trailers so that when the time comes to have a meal, that people are able to respect guidelines concerning keeping a distance between one another. So those things are really important to do. Together with Jean Boulet, we are repeating it. And of course, if a worker in the construction sector falls ill, they stay home, period. So it is important to be able to protect our construction workers. We're going to need them. This is a critical part of the Quebec economy that is going to be able to continue functioning if we do take the correct measures. So we have to protect those people. I also wish to say a word on the media. First, I wish to thank you, of course. The information, the guidelines that you've been transmitting is important, and also the false rumors that you put a stop to. I know that the media right now are going through a difficult time financially. Of course, advertising revenue is not so good, and taking into account that a lot of businesses are closing, it's perhaps not time to make advertisements concerning cars that are being sold. And we are looking at what can be done financially, because this is a sector that is also critical for the next few weeks and the next months, and we have to continue. We need you in order to be able to inform the population. This is an essential service. And I'd like to take advantage of this opportunity because you are also working in difficult conditions, and I wanted to take this opportunity to thank you. Perhaps a word on L'Auto-Québec. There was a question yesterday. We, of course, don't want people to go to the corner store only to buy a lottery ticket. So we have asked L'Auto-Québec to review the rules. This will be done probably quickly. So, of course, they'll be able to, sell online. But we don't want people to go out and take risks only to go buy a lottery ticket. So I would like to end by repeating that every gesture that we take to limit physical contacts does limit contagion and will save lives. So I wish to once again thank everyone, and I'd like to take this opportunity to also thank Dodo and Bernard de Rome, who have accepted very quickly to be able to help us out to communicate with the population. This is important. We have to respect guidelines, and if we do so, altogether we will succeed in getting through this. I thank you. And English.
In English for our fellow Anglo-Quebecers, the situation remains under control. The public health authorities tell us that our efforts are working. Every action we take to limit physical contact will save lives. If you feel sick, stay home. Our health system is ready, and we're working on getting more equipment if it's necessary. So we must continue our effort, and we'll get through that together. Thank you.
Merci. Alors, pour la période des questions, d'abord en français, avec une question.
Our question period, starting. So you've had guidelines for Quebecers, and you have them every day. You decided to close down Parliament until the 21st of April. Parents and teachers of Quebec would like to know whether the scenario of going back to class on the 30th of March is still on the table. We are looking at different options. There's like two sectors. There's primary and secondary, and then there's CEGEPs and universities. I think that CEGEPs and universities, we are going to succeed in having remote classes to be able to complete the school year. As far as schools are concerned, primary and secondary school, we are studying different scenarios. It is rather unlikely that we'll be able to send people back to school at the end of March. We are seeing whether we can target the beginning of the month of May, but different scenarios are being examined right now. Teaching online for younger children seems to be very difficult. I'm thinking, for example, of all the children that have difficulties as well. So we're looking at different scenarios right now, and in the course of the next few days, we should be able to give clear indications. Mr. Premier, you mentioned that you had the ability to have diagnosis tests that was superior to the demand right now, but it seems that the problem is not necessarily getting the results as much as having an appointment to be able to get a test. Is the problem not so much the capacity of labs in analyzing the test, but rather having the staff to be able to do the necessary samples? Because it seems to be that there's important delays. Well, there's three things. There's the 811 line where you are transferred if you need a test. So that there's still work to be done, but we have added a lot of people and continue to do so. So that is the first step. And I think that yesterday we had 2,400 people that were supposed to have a test and that were able to have it, and there's a capacity of 6,000. So whether it be the sample or the analysis, there is a capacity of 6,000 per day. So there perhaps the greatest constraint is more the triage that is done at the 811. Yes, and it's improving quite a bit. We've decreased by an hour the time that people wait yesterday, and we have 50 extra nurses. We have 2,000 calls, extra calls, and today we're adding another 150 nurses, so it's going to improve by quite a bit. Yesterday we referred 3,000 people in order to be able to have samples, to have these tests. We have a capacity right now that is going to be increased even further in screening clinics and labs. We're now at 6,000 for analyses, but we have a capacity of 1,300, 500 with all the labs that we have. So as far as the sampling is concerned, yes, as well. That was your question. We will be improving volume. A delicate question, but I need an honest answer. We have information to the effect that there are 2 emergency doctors at the Granby Hospital who have been infected and have been withdrawn. Is that the case? And do you think that there might be a break in services in that region? If you allow me, for reasons of confidentiality, I don't want to go into too many details, but there are health professionals, in fact, that were affected. But we do not plan on any break of services right now because we have contingency plans in the case of those situations. But in the fact, we have no signal of any kind of breakage in the service. There are now many doctors, specialists and others, who, depending on the cancellation of elective surgeries or any kind of elective service, are going to be able to work. Each situation is being analyzed and investigated, and of course, our priority is the health of workers and patients as such, and to maintain the services. I'd like to take a few minutes in order to talk to you about the network and also talk to the staff. Today, I wish to thank them first and foremost. The staff, the doctors, the nurses, the clerks, the organizations in the community who work a lot together in our network. And we know that food banks, crisis centers, shelter centers, those are essential. So I wish to thank all those people who are working right now. I want to tell you that we received not only 10,000 resumes, but 17,000 resumes in the network of people who want to be involved. But what I want to tell you is that there's no breakage of service because people are there. And also we are reorganizing the network. So we are leaving aside elective activities. We've already freed up 4,000 beds. And yes, there is staff that does not have, who don't come from the same sector of activity, but who can come and help with the new activities that we are having for the COVID-19 situation. And I really want to reassure the staff that we are taking every necessary measure. We have instructions that they know and that we are repeating. It's on the website of the ministry. It's in the different teams at the health offices. Our staff are our guardian angels, as the Premier says. So we will have the necessary equipment to reinforce them. It is clear that there are trajectories that have reviewed in order to be able to have protective equipment. The instructions are clear. We are going to give them everything that they need, especially, of course, in the critical sectors, but also everywhere where it is required. So I wish to thank them today for the considerable effort that they make and tell them that we are backing them. They are the apple of our eyes. You've added a lot of sampling services, but how does that work for people who cannot go and be tested taking a car? Are they supposed to take public transit? If those people take a taxi, do they have the obligation of disclosing that they're going to have a screening test to the driver? And are you eventually thinking of establishing a system to go get those people at home in order to be able to screen them? Well, listen, what you're raising as a point is really important. I had not heard about that yet. But if there are difficulties, we, of course, will see to them because we know how important it is that we screen as many people as possible. Because we do want to decrease that curve, what we've been talking about, and we need that information. I would perhaps let Dr. Arruda answer the question of the taxi driver. But if there are people that are that need transportation, I'm certainly taking note of it, and we'll see what we can do to help them out. And we have to also understand, generally speaking, I want to maintain an important message. All the measures that were ordered and recommended, they have to be applied. I find that important because people focus a lot on the tests, on the masks, and etc. I'm telling you, if you want to protect yourself, follow the guidelines. We said that we were following the situation every day. Now we're following it hour to hour. And depending on where we'll be from an epidemiology point of view, we're going to test in priority certain people. For example, when we were in a situation where there was no circulation here, we had to test people who had traveled and who had symptoms. If you don't have symptoms, don't go to have a screening test. And as things evolve, we will stop having certain tests because they will no longer be necessary, but we'll go to another category. Like right now, we are going to start testing patients who are hospitalized, even if they didn't travel in intensive care, to see, because maybe they caught it from somebody who, and they didn't know. We're going to start, so we're testing health professionals who are symptomatic, who have symptoms, to make sure that they are not ill and that they're not going to be transmitting that in a hospital setting. So the testing priorities are being analyzed together with our experts depending on where we're at. So there will be variations. You'll recall I had said, don't ask me what I said yesterday compared to today. It's a very dynamic phenomena that we're in, and these choices are made in function of the use to treat the patients and to know what is happening in the population. It is clear that with an increase in the number of screening tests, we are going to detect more cases. It doesn't mean that there is a very sudden increase. It means that they were there and undetected. But up until now, the situation is under control, and we are following it very, very closely. What people can do to help us the most is to respect the guidelines. As the Premier was saying, if you have symptoms, stay at home. If there's still people who are getting together, not outside but in homes because they want to have dinner parties, that is how the disease got transmitted in China. Listen to the guidelines, and we will adjust the screening test depending on the different populations, and we're going to try to communicate these changes clearly. Yesterday, Mr. Arruda, you were saying that we're still in a first-generation transmission. Has that changed in the past 24 hours? Do we have in Quebec places or a place where there is second-generation transmission going on right now? We are investigating situations right now, and I want to tell you something that is very important. Yes, it is possible that in some place they may already be at a second generation. Are we in a second generation that we can stop in that area? Because it wouldn't be all of the province that would be in that. Because if you look at the curves in the world, look at the curve of a country, for example. When you look at it, it's very different from the one that we have in Quebec, which is a province, even if we are a nation. It's a province that has characteristics, and we do this analysis, people, time, place. The situation in a geographic zone might be different. For example, there might be only cases of people who traveled and no other cases, and it'll stay like that. And we'll tell you when that changes. But at this stage, whether you're at 1 or at 2 or even at 3 at regional levels, tomorrow or the day after, the measures that we have set up remain the same. And I can tell you, I think that the closure of the borders is something that is permeable. You'll be able to see certain graphs that have been made. The most important thing is not necessarily isolating a city. I'm not telling you that we're not going to get there. I'm just saying that the most important is that people remain at home. I mean, since there are still people that move around, if you're in contact with that person, you might catch the disease. If you remain as often as possible at home, you will avoid going to different places. That is what is so important. As far as the other decisions are concerned, decisions that will have been taken by the Premier after having consulted with the experts on isolation, because we're going to see local situations that will arrive and it will worry people, and it's totally legitimate. Mothers, people, but we have to do a sustained epidemiological study. We have all sorts of people who are studying the data hour to hour. You talked earlier on about the equipment, Mr. Legault, and I think we understood that the most important equipment is that ventilator. You said that you got informed with local suppliers. How many do we have? How many would we need for the peak? Should we order some from the Federal Reserve? Do you have any numbers on that key point? I think that we have to be prudent with numbers because there are masks and ventilators in many different places in the network, even in certain cities like Montreal. We have orders that have been confirmed. Some have been suspended, some are ongoing, and in certain cases, certain are being controlled by Ottawa, and they are redistributing them to the different provinces. So we are looking at all the scenarios, as I was saying earlier on. So for the short term, there are no problems. In 2 or 3 weeks, it will depend on these scenarios that we're thinking about right now. And right now, we don't want to exclude anything. We're looking at even the most pessimistic of scenarios. And for those most pessimistic of scenarios, we do not exclude to have some manufactured. We're talking with the federal government, with the Ontario government. There are businesses already who have offered us their collaboration. There are other businesses that we solicited ourselves. But the masks and ventilators, for sure, everyone in the world is going to be looking for these things. So we have to also follow what's happening in New York, what's happening in the United States, what is happening in Europe. So things are evolving very quickly. But for the time being, I want to reassure everyone, in the short term, there are no needs for equipment. I would like for you to talk to us more specifically about the Estrie region that has maybe 5% of the province, but I don't know, 20% of cases. Are there any particular measures, stronger measures that are being thought about for that region? For the Estrie region, it's the same measures to stop those situations. The Estrie is a small volume with many cases, but you have to understand where these cases come from. How were they generated? It's associated to factors that are probably, following the week off. People had certain people, contacts. There's an analysis being done right now. And what I want you to keep in mind is that all the measures that will have to be taken in the health system or in the community in that region are going to be taken. Right now, it's the Estrie and it was spring break. So we're looking at this. If anything happens elsewhere, and Quebec is not all at the same level either, and it's important to mention it. And I'm also, I'd like to repeat another thing. We're going to be talking about fewer travels, but the baby boomers that are coming back, the 14-day isolating measures are really important. I don't want to have a detailed analysis here about the Estrie region, but what I want to give as a message is that the public health teams are doing what we recommend as being the highest standards. There are perhaps people who are going to tell me, why do we isolate that area? Why don't we close the inside of that area? But as a general principle, we said avoid any non-essential traveling between one region and another. But to get to a region of blocking and isolating a region entirely like the Estrie, we have to have good criteria and good analysis. There's a lot of information going around. I want us to base our decisions not on rumors, but what we have. That is why investigations are being made. Of course, the media is very active. People talk about this, but you have to look at every single case, and you have to have analyses, and that is done continuously, day and night, to be able to take the right decision at the right moment. But for the time being, if tomorrow we decide something else, we'll tell you. We'll do it. Perhaps even we'll do it before even announcing it in a press conference if it's necessary. But for the time being, it is still being analyzed in a very detailed. All the little outbreaks that can be big, according to you, because we see it big because it's Granby. If you place them in a Quebec perspective, it's still small, but we're not neglecting anything. That is why there is a director of public health in each region, together with a team, and those people give me information. And that information has to be validated. It can't come from what I saw in the media. How many people amongst those who are hospitalized are in intensive care? And Mr. Premier, you've been talking a lot about the different scenarios, pessimistic scenarios, but it's been a certain number of days already that the crisis has lasted. So we can see that there's a certain, speed that is being reached. People are asking themselves questions. What part of the population could be infected by the summer? Listen, it's really difficult because if we look at what happened in other countries, and even if we just look at the U.S. states, it fluctuates so much from one state to the next. The luck that we have is that we acted faster than others. That should allow us to have a curve that is not as pronounced. But listen, I mean, if we consult 5 experts, they're going to have 5 different numbers to give you probably. So it is very difficult to answer. But I'd like to add perhaps one thing that to what Dr. Arruda said. I don't want there to be any false rumors. There's no question, and I've asked, there's no question of closing down the Estrie region. There is no question of closing down the Montreal region. Those are all false rumors. It's important to say so.
Pour une deuxième ronde de questions.
6 out of 10 people, those 10 people are in critical care. Second round of questions. I know that you have some for your colleagues as well. Are you thinking about the fact that the quarantines will be prolonged for people who are coming back from travel and who have symptoms past the 14 days? Well, that is to say, if somebody came back from traveling and is placed in a quarantine for 14 days, after 14 days, the risk linked to the travel itself is eliminated because most people develop symptoms before that. But, just to be on the safe side, we wait for 14 days. But that person should not start walking all over the place here and there and gathering and having dinner parties at home because the risk is not only outside now, it's here. So, in fact, the 14 days when you come back from traveling is mandatory. It has to be respected. That is really, really major. And you should not be in contact with somebody. Let's say, you just came back from traveling? Okay, wait, I'll see you later then. And after, it'll be the same guidelines that we've given every single other Quebecer who hasn't traveled. We were talking about first, second, third generation cases. There's a lot of worries that have been expressed since the announcement of that death in the Lanaudière region at the residence where this lady resided. The same thing in Côte-Saint-Luc, where we learned that there's also is a case in a residence for the elderly. Are we in presence, either there or other places, of clusters of outbreaks? Well, there are cases. Now it's the question of image. Let's say that we have one case in one center and there's no other secondary cases. Well, we have one case. A case where there was 3 or 4 people, there's a small cluster, and I would like to talk about the curve. Of course, when we look at the Quebec curve that corresponds to 8 million people, we'll see because of the height of the quantity, we don't put it in a graph that, flattens it down like this. But if you compare the curve of Quebec to the curve of elsewhere in the world, in the rest of the world, you see big increases like this. Even if we have an increase like that, compared to the curve elsewhere, we're still in the little flat area at the beginning. That's what I want you to understand. The curve of a country and the curve of a province is the sum of curves that we have elsewhere in the province. I just want to say with that we'll see, it's going up, we have 12, but already, and I don't want to get ahead of myself, but we have noticed that it is not going up as high as it was, even though we've increased the screening tests. We're looking at all of that together. So we are acting ahead of time by anticipating things a lot. But right now, what we want is to flatten the curve. So we need you. We want to make sure that we have everything ready to care for people 1 or 2, 3 weeks ahead of time so that we're not stuck unprepared at the last minute. And also to plan if we have a more serious scenario to have extra equipment. But as of today, we are able to investigate and to do that. And we're keeping an eye on it from day to day. And now I will tell you from 1 hour to the next. And that is why we're going to have frequent press conferences, and maybe, at some point we'll have to have even extra press conferences, but the situation is under control. And I'd like to remind you of what you have to do. Wash your hands. If you're ill, do not go outside. Practice respiratory etiquette and listen to us. That's what you can do. Don't go into panic. Do this adequately, social distancing physically, but remain connected through social networks. And there's been activities that have been set up that are going to help you get through this better. Let's talk about hope. There's medication right now that is being tested around the world. Claretra. We don't know if it's available, if it was used for SARS. Remdesivir, I don't know if I pronounced it correctly, being tested in the USA, and chloroquine, which we have right now in Quebec and which we could test much more quickly. It seems to me that the tests in France have been working very well. Why don't we accelerate trials on that medication here? If you'll allow me, our National Institute did the literature review very specifically about that. Clinicians are going to have guidelines. There are studies that are being done elsewhere, but also with Canadian researchers about different antivirals. We're not at the back. It's not like we haven't done anything. It is being reported as being very efficient, efficacious in certain situations, but it can't be given to just anybody. It's not a specific medication as such. But I want you to note that our best experts that do our medication protocols, and we're also working together in the research domain. We're not are doing work on that. You have to be careful sometimes with what is being published. We want to know what the probing value is. Chloroquine is going to be used in certain very severe cases, but it's not necessarily efficacious for certain levels of the disease, and that's what you have to look at. You have to look at the information, the billion of information that is available, the ones that are associated with credible sources. We have contacts, we have Canadian researchers elsewhere. It's very important. And the medication is probably, we hope, is going to arrive before the vaccine. We receive messages of people who are worried, whose parents live in CHSLDs and who are used to eating, and apparently they continue eating together at the cafeteria. Shouldn't we change the way things are done in certain residences for the elderly? I said CHSLD. I didn't mean that specifically. I'm talking about anywhere where the elderly live together. Okay, well, listen, I am in contact with Ms. Blais, Marguerite Blais, and we know that it's a big change. We know this. So right now, we have people right there. We know that there's a lot of people who have mobilized themselves and who understood. I mean, I've heard that in certain places the hallways are completely empty, but there might be places where the guidelines have not been understood. So we're going to make verifications, and it really is important to not get, together and eat all together in the cafeteria or the dining room. So I speak with Ms. Blais very often. And the team at the ministry is going to do all the verifications of those situations. I have been told that in certain hospitals in Montreal, amongst others, the parking lots, the hospitals are continuing to bill for parking. And perhaps the best way to avoid that people take public transportation would be to make sure that the parking lots are free. Well, it was coming at the end of June, and we were supposed to start certain parking lots because it was more feasible, because we couldn't do them all at the same time. Oh, I thought that it was for the population. Oh, for the staff, you're talking. Okay, well, we're going to have a look at. It's not something we had been talking about this for June. We'll see what we can do about that. That's all I can say today. We're going to analyze that. Yesterday, Dr. Arruda, you talked about the fact that we're ready to take war measures that has a certain level of residence. Are there any steps being taken right now with the Canadian Army, for example, or are they ready to intervene? Has there been notice? Is there a notice that has to be given to them ahead of time? Okay, I want to clarify things. I was asked whether we could get up to that. I said, well, I cannot predict the future, so we could get there, but we're really not there yet. We really aren't there. But in situations, for example, and we're not there because we prepared a population. Imagine if we had waited that people, if we had announced a whole series of things from one day to the next and people wouldn't have understood the sense of what we were trying to do, and then there were mobs and the police officers couldn't control them anymore and people started protesting in the street. It's in those situations that we would use war measures, but that's not where we're at. We are in prevention right now. We are very much in prevention. And here it's rare. It's a treatment that is usually the best thing to do, but in this case, prevention is the best. Now, if we don't do prevention, we'll have problems with treatments because we don't have a treatment, we don't have a vaccine. So what I said was in a perspective of, yes, is it possible, but we're not there yet. We're really, really very far from that. Thank you. The SAQ employees, some of them are asking that it close down. Will it? For the time being, stores stay open. The SAQ, like the others. Hello. There are many workers, state workers, writing to us to say that they can't work from home, and in at least 2 government buildings there are employees that have been tested and were found positive. Mr. Legault, are you disappointed with the answer that was made by the ministry and departments to favor as much as possible working from home? Well, listen, I talked about it once again with Christian Dubé, and they are working on that to make sure, of course, to protect the data of Quebecers. So in 5 years, we be able to work from home more, certainly. So we are trying to do the most of what we can do while protecting data. And I think that the answer is very good. The response has been very good. A lot of people are working from home right now. English?
I think the English-speaking community probably appreciates the little bit of English that you've added in your statement, especially in a crisis.
Right. I'll continue to do it.
We're seeing, and Mr. Arruda was speaking about the foyers, we're seeing a development of small hotspots where the virus is emerging. We have a situation in Côte Saint-Luc in particular. There was the Cavendish Mall has been closed. There was a case of someone in a synagogue, I believe. How are you targeting, and do you have different tactics? Do your workers have different tactics to deal with particular zones like that? And is there any chance that you would have to start closing stores in those? Mr. Laforest spoke about Granby. Would there be something specific in like a zone where you see there's a growth of numbers?
The most important thing is to get a good diagnosis of the situation, not the rumors. Being able to understand what is happening. And it's true that it could be applied, but always with the same protocols, always with the same approach, could be applied differently from one region. If there is those small spots which seems very big when you're in Granby, but if you're in Quebec City, you're seeing all things around together. And if you're in Canada, it's a mining spot. So, but we will analyze everything. And as I'm telling you always, this is person, time, and place issues. So when in one place we obtain the levels where we must do something else, we're going to do it. But it's not meaning that Montreal, Granby, Estria, Gaspésia, Chicoutimi is going to be on the same place, time, and so it's normal that there's going to be a different thing. But when there is the same thing everywhere, it's because it's almost at the same level everywhere.
Now a question sent by email from Raquel Fletcher, Global News. Should pregnant women, particularly those working in the health sector, be sent home as a precaution?
This is managed based on the epidemiology, and we want to protect the woman, the baby. There is already adaptations of those persons where they're going to be. This is taken into account with our recommendations everywhere. But as there was no circulation of the disease at that time, there is still people getting to hospitals but not being treating COVID-19 things. But if things change, we're gonna apply precaution to that person.
Katsune, CBC.
You spoke, Philip asked you about Côte-Saint-Luc. If the mayor of Côte-Saint-Luc wants to put Côte-Saint-Luc in quarantine, what do you tell him today?
No, I think first of all, I want a good diagnosis. I want my people of public health giving me the right information, what is doing, what is the level of inquiry they can do, and then that is going to be discussed with us at the central level. I think it would be dangerous for mayors to take those decisions without being in touch with us.
Why?
Another question for...
Why? Because it's important to have not only the aspect of your own city, but what is going on around, and sometimes it's going very fast. There is rumors or stories mixed up with other ones, but I think that the city will, from my perspective, my prime minister can take another decision, but actually it's an exceptional situation. We never had this I would say, in the world, and I think it needs to be not a decision taken in a corner because I'm afraid of everything or because I don't have all the data to take a decision.
Another question for CTV sent by email. Are you looking at adding an online triage tool similar to the other public health ministry for people to decide if they need testing?
Yes, we are, actually, and it's in development right now, and it's going to really, really increase the volume of what the people who are going to be sent to the testing. But at the same time, it's going to screen very well. And I think we're going to be able to confirm to you very, very soon that this is effective and it's working very well. We're testing it right now.
Okay, another question in English, Mr. Otier.
Yes, it's for Mr. Legault. We saw last week a story about you and the Deputy Premier, Madame Guilbeault, not working too closely together to protect yourself and Madame Guilbeault in case someone was to get sick. I'm just wondering, how are you holding up? You're working very hard. How are you doing?
I'm in good shape and don't see any problem, but I think it's to be responsible. Yes, we plan that if something happened to me, that Mrs. Guilbeault will replace me, and we are doing that also for Dr. Arruda, for Daniel, for the key people. I think it's important to have a backup, but I feel very well.
Last question, Katsune.
Premier Legault, you said yesterday that you want Quebecers to avoid any non-essential regional travel in Quebec. The weekend is coming. Perhaps some children would like to help their parents living in other regions. I had this reflection. I had to stop myself. So what do you say? How do you going to enforce this?
Please don't travel between regions. It's important right now that, and you see the figures. The figures are quite different from one region to the other. But even if you take the worst place, it's not a situation where we have to close our regions. That's important. But, of course, it will evaluate in the next few days, few weeks. So we have to be careful and limit traveling.
That's it. Thanks, everyone.
I know that one of my his birthday is Sunday, and unfortunately, I won't be able to see him. He's in Montreal, I'm in Quebec City, but that's life.
Merci tout le monde. Merci pour votre collaboration.